The subcommittee will come to order, and the chair will recognize himself for 5 minutes for opening statement. However, there's a lot of fluid things happening in the whole House today between both sides, and so we're going to have to try to manage this hearing as we move forward. And thank you, everyone who's testifying first and second, for patience and willingness to work with everyone. We appreciate that. The chair recognizes myself. I will recognize myself for an opening statement. Today, we're considering legislation aimed to provide greater access to care for seniors, including lower-cost prescription drugs, as well as reducing unnecessary red tape for healthcare providers. We're also considering proposals designed to make updates to our physician reimbursement models that strike the critical balance between driving higher quality care while ensuring Medicare program remains solvent for future generations. According to a September 2023 report, the Centers for Medicare and Medicaid Services, spending on healthcare is expected to grow faster than GDP over the next decade. This is simply unsustainable, especially for our Medicare program. The data shows per person healthcare spending of those over 65 costs on average almost 2.5 times more than the average working person spends, with the federal government picking up much of the higher share of the spending. Their support only further underscores the need for today's hearing and to examine policies intended to sustain and strengthen the Medicare program. This is the first time in several years that we've thoughtfully examined our reimbursement system for physicians, many of whom are providing specialized care for seniors with chronic conditions. These conditions also require coordinated care that spans across multiple providers and clinical staff, requiring every targeted reimbursement that incentivize meeting higher quality standards for these patients. These are complicated problems and they require serious solutions. Our goal is figuring out how to preserve best access for seniors in a sustainable and responsible manner. This will require constructive work between stakeholders, regulators, and this subcommittee. Any changes we ultimately pursue will be fully offset and promote the highest quality of care for our seniors. I want to thank our witnesses for being here today, our first panel, and I will yield my remaining time to the Vice Chair of the subcommittee, Dr. Larry Bouchon.
Thank you, Mr. Chairman. This hearing means a lot to me. As a provider myself, many of the issues on today's agenda are priorities of mine. Ensuring patients have access to quality providers is the most fundamental reason why I came to Congress in the first place. I want to talk for a moment about why this hearing is so important. Providers choose to work in healthcare because they care about people. They invest years, often decades of their lives to training, and then they work grueling hours, many of them. They sacrifice time for themselves and time for their families to take care of patients. And while they're working, they have the lives of others in their hands, which can be incredibly stressful. We owe it to these providers and their patients to allow them to focus on patient care, not worry about the massive amounts of paperwork waiting for them at the end of the day, or about the long-term ability to operate their practice. We know Medicare is the single largest payer for healthcare services in this country and often shapes how private plans approach coverage. It is critical that we ensure Medicare operates in a way that supports providers, thereby ensuring that the millions of seniors who rely on Medicare continue to have access to their doctors. My passion for this issue is why I've worked for many years to get the Improving Seniors Timely Access to Care bill across the finish line to remove certain prior authorization restrictions from Medicare Advantage. It's why for years I've led the charge in bipartisan efforts to ensure that physicians are reimbursed appropriately, including H.R. 2474, to provide them with inflationary updates to reimbursement levels. And it's why I believe strongly that we must pass legislation to promote value-based care, as was intended when Congress passed MACRA, the Medicare and CHIP Reauthorization Act, in 2015. I hope my colleagues will join me today in recognizing the importance of these issues and commit to working with me and others on this committee to ensure provider access for Medicare patients. Mr. Chairman, I yield back.
The gentleman yields back. The chair will now recognize the gentlelady from California, Representative Eshoo, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. I think I speak for all of us to say it feels good to be back in our hearing room doing our work. So it's good to be with all of you. Last year, my constituent and the president of the California Medical Association, Dr. Donaldo Hernandez, wrote a letter to me saying that, quote, within our healthcare system, a crisis of grave proportions is taking shape, unquote. It was November 2022. While COVID cases had eased, healthcare workers were still struggling to keep up. For us and the patients we serve, Dr. Hernandez wrote, the crisis is far from over. The California Medical Association surveyed its members about how Medicare payments are impacting access to care. And the responses were really striking and I think highly instructive. 87% of physicians said low Medicare reimbursement rates negatively impact their ability to recruit and retain physicians. And 76% of physicians said Medicare payments did not cover the cost of providing care. A few bills we're considering today attempt to stabilize doctors' Medicare reimbursement, although we're notably not considering Dr. Bouchon and Dr. Ruiz's H.R. 2474 to provide a Medicare physician payment update tied to inflation. I think that is really a must on a bipartisan basis. I also often hear from physicians in my district about administrative burdens from Medicare and commercial health insurers. For example, 7 years ago, Congress passed MACRA, or the Medicare Access and CHIP Reauthorization Act, as Dr. Bouchon said, to finally end the annual need to pass the doc fix to save doctors from cuts to Medicare reimbursement. That legislation created the merit-based incentive payment system, which the GAO found added more administrative burden while doing little to improve quality of care. I think our subcommittee should seriously consider MedPAC's recommendation to eliminate the merit-based incentive payment system. While traditional Medicare increased its paperwork through MACRA, Medicare Advantage plans also started burdening doctors by overusing prior authorization. Prior authorization has morphed into a costly, inefficient mechanism that prevents patients from receiving care, and it adds unnecessary burdens onto providers. And it's why I support the Improving Seniors Timely Access to Care Act to reduce the overuse of prior authorization in Medicare Advantage plans. While this hearing is focused on improving patient access to care and reducing burdens on physicians, I'm concerned that my Republican colleagues once again are not considering legislation to fund state health insurance programs and the area agencies on aging. These are two programs whose funding expired on September 30th. And as I said, not that you would remember it, at our last hearing, California State Health Insurance Program is called HICAP. This is a program that works, and it works very, very well. It provides stellar services every day for seniors in my district who have Medicare problems, and we should not allow this to expire. I'm also concerned that our subcommittee is once again considering a huge slate of bills, 23 in total, with nearly half either in discussion draft form or only formally introduced a week ago. I look forward to hearing from our witnesses today on how we can enhance beneficiary access to care and reduce burdens on physicians without jeopardizing the financial sustainability of the Medicare program. 10,000 Americans age into Medicare every single day. So if that isn't reason enough to find a solution to these issues, I don't know what is. So thank you, Mr. Chairman, and I yield back.
The gentlelady yields back, and I will now recognize the chair of the full committee, Chair Rogers, for 5 minutes for an opening statement.
Thank you, Chair Guthrie. Good morning, everyone. Our focus today is to explore solutions to improve Medicare payments to providers and ultimately help patients. Everyone has been hurt by inflation, driven by President Biden and the Democrats' record spending spree. Just last week, we got 2 more pieces of bad news on inflation. First, Medicare Part B premiums are increasing by almost 6% next year. In fact, since President Biden took over, Medicare premiums are up nearly 18%. Next, we found out that core inflation metrics show prices continuing to increase by 4% over last year. But inflation remains a huge problem. Everyone, from patients to providers, is feeling the pain of higher prices and higher interest rates. Patients have less money to spend on basic needs, food, housing, healthcare. And for providers, the cost of running an independent practice is growing as well. This committee has heard testimony that the whole healthcare system becomes more expensive when providers cannot afford to stay independent. Today's hearing will focus on how we can eliminate unnecessary red tape and, most importantly, sustain access to care and lower costs for Medicare beneficiaries, regardless of where they live. As many of my doctor colleagues have said, it is important to let doctors do what they do best, spend time seeing patients and less time filling out paperwork. The challenge before us is how to balance the need to ensure patients and Medicare are accurately paying for that care, while recognizing that paperwork, even if well-intentioned, can limit time spent on providing health care and increases cost. As we look to modernize our Medicare payment system, we must be thoughtful in striking the best and right balance. Today, we'll consider a wide range of discussion drafts and legislation that aims to support Medicare providers as they deal with rising paperwork, rising inflation, and rising labor cost. For example, a few discussion drafts address expiring payment initiatives. If Congress does not act before the end of the year, doctors in certain rural areas and laboratories will see a pay cut from Medicare starting January 1st. In the short term, Congress should act to avert these cuts. But we should consider why we're having the conversation every single year. If we need further proof that government should not intervene in the economy, look no further than the physician fee schedule. In our efforts to create a more perfect price control, Congress has increased Medicare payments to doctors seemingly every single year since 2003. I'm not saying that these aren't worthy endeavors. I believe in supporting our doctors. In 2015, this committee in Congress passed MACRA to get us out of the cycle of the annual fixes. Yet here we are with a system that again has underperformed those who rely on the Medicare program. And still, some of my colleagues across the aisle would expand such a system to cover every patient in the country. The fact is, politicians and bureaucrats will always do a worse job than the market at determining the most efficient prices for an item or service. And Congress should spend its efforts on long-term reforms to the program we have now, so we're not back at this every 1, 2, or 3 years. It is also important that we recognize the greater context of this discussion. Parts of Medicare are on pace to be insolvent by 2031. Solutions like the bipartisan Lower Cost, More Transparency Act will save Medicare money in the long run. But our resources are finite, and we must make sure that we're examining every dollar Medicare spends and making sure that it's going to the right places before assuming additional resources are necessary. If additional resources are necessary, we should work together to find ways to save Medicare money in other areas. Again, our goal today is to strengthen the Medicare program and increase seniors' access to care by improving the way we reimburse providers. And I thank our witnesses for being here today, and I look forward to the conversation. I yield back, Mr. Chairman.
The gentlelady yields back. I now recognize the ranking member of the full committee, the gentleman from New Jersey, Representative Pallone, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. It's now day 17 of the House being paralyzed without a speaker, and we're 29 days away from another potential government shutdown. This hearing comes at a time when House Republicans' dysfunction is hurting the American people, weakening our economy, and undermining our national security. All year, House Republicans have caved to the extreme elements in their party who have no interest in governing. They've forced severe cuts to critical federal programs in spite of a funding agreement between the former Speaker and President Biden, and they came dangerously close to a government shutdown that would have cost our national economy upwards of $13 billion a week and forced our troops to work without pay. I just think the American people deserve better. Democrats have repeatedly stopped this chaos and dysfunction from hurting everyday Americans, but it's long past time for House Republicans to reject the extremists in their party. We should be working together to lower costs for American families and to grow our economy and the middle class. It's time for the chaos to end. Now, turning to the topic of today's hearing, Medicare has played a critical role in the lives of our nation's seniors and disabled Americans since its enactment. Medicare is the main source of health care for most of our nation's seniors and disabled individuals, and we must ensure it remains sustainable long-term and delivers the highest quality care. I have major concerns about the process leading up to today's hearing. My Republican colleagues shared a vast majority of the discussion drafts we'll be discussing less than a week before the hearing was noticed. Many of these drafts are still half-baked, and given the broad array of topics and bills, I am disappointed that we did not have adequate time to fully vet some of these policies and provide Democratic input from the beginning. The Republican majority has also put forward a long list of expensive Republican-led bills that could collectively cost billions of dollars without any proposed way of paying for them. And this is especially ironic given that just yesterday, in a speech on the House floor nominating Jim Jordan as their candidate for Speaker, Republicans expressed concern with Medicare's finances and cited their support for Jordan because of his desire to make devastating cuts to our nation's social safety net healthcare programs. It's unfortunately a pattern we see over and over again from Republicans, pushing forward expensive policy changes and then demanding devastating spending cuts to Medicare that would increase costs for seniors. The truth is, Medicare is not broke. It does not need major changes. And it certainly does not need terrible Republican ideas to cut benefits, raise the retirement age, or increase seniors' cost contributions. What we need is for Republicans to stop their infighting so Congress can come together to find bipartisan solutions for the American people. Now, while some of these policies before us today may have merit and address critical needs of both Medicare patients and providers, unfortunately, my Republican colleagues have thus far refused to engage with us constructively or propose a path forward to move these bills on a bipartisan basis. Given the Republican majority's unproductive track record on the House floor this Congress, I remain concerned that we're not going to be able to successfully move a bipartisan legislative package out of committee onto the House floor and to the President's desk. My Republican colleagues also rejected committee Democrats' sole request to include legislation in today's hearing that would directly expand access to care and reduce health care costs for seniors. The majority refused to include H.R. 5630, the Helping Low-Income Seniors Afford Care Act, led by Representative Craig. The bill would directly expand coverage for seniors and lower their out-of-pocket costs by extending funding for outreach and enrollment programs. These programs help low-income Medicare beneficiaries enroll in Medicare and access benefits that lower their out-of-pocket costs. Thanks to these programs, about 3.5 million Medicare beneficiaries have received assistance, and the number of seniors enrolled in the low-income subsidy program increased from 11.8 million in 2014 to 14.2 million in 2020. Now, let me just say, I'm concerned that the totality of these proposals would result in significant funding cuts to the Medicare program and raise health care costs for seniors through increased premiums. This will place additional undue burdens on our nation's seniors and raise their out-of-pocket costs. Democrats stand united in opposition to any Republican efforts to cut Medicare benefits, raise the retirement age, or increase seniors' cost sharing or premiums. And we will continue the fight to protect the Medicare program. And I thank all of our witnesses for being here today and yield back, Mr. Chairman.
The gentleman yields back. That concludes opening statements. We will now turn to our panel for the opening statements of our panel. I will introduce I'll introduce each panel member, then we'll begin with you, Dr. Sheshamani. So first, our first witness, Dr. Amina Sheshamani, Director of Senators for Medicare and Medicaid Services. Ms. Leslie Gordon, Director of Healthcare at the Government Accountability Office. And Mr. Paul Massey, Executive Director of the Medicare